Hey everyone, Dr. Charlie Johnson, physical therapist here. And in this video, I want to settle a long-standing debate about piriformis syndrome and answer a question that I get a lot. And it's basically this. So, hey, Dr. Charlie, I've watched Bob and Brad, I've watched Squat University, all of those, different channels, and they talk about this idea of short versus long piriformis syndrome. So, how can I tell if I have a short or a long piriformis type of problem? And what do I do about it? So I constantly, again, have people that are suffering with a pain basically in the butt, maybe sciatica as well. And they're reaching out to me. They're commenting on my videos, and they want to know and kind of be able to determine if they have piriformis syndrome, number one, and then what type of piriformis problem they have, and then obviously what they should do to solve it. So I want to clear up any confusion for folks dealing with, again, a pain in the butt, piriformis syndrome, deep gluteal syndrome, whatever the heck you want to call it, who might be wondering the same things. So be sure to stay till the end, because I'm going to share with you some key principles, tips, and tricks, and sort of a logic that I use to help people with piriformis syndrome, or again, just a pain in the butt, to heal naturally. And in case you're new to this channel, my name is Dr. Charlie Johnson. I'm a physical therapist and board certified orthopedic specialist. And basically, I help people with back, butt, and sciatica problems do deep detective work, right? Heal naturally, figure out what the heck is going on, and teach them how to use movement as medicine. So if you want to learn how you can fix yourself and have the tools, knowledge, and understanding to do so, then go ahead, just hit the subscribe button as well as the bell to be notified when I post content every single week. So let's get right into it. All right, so let's get started debunking this long versus short piriformis syndrome type of issue. I'm going to share with you everything you need to know so that, again, you can end the confusion and you can get started on your path to healing. So first things first, just realize that, look, when it comes to dealing with a pain in the butt, one potential cause could be something called piriformis syndrome. Many people believe this. I'll share with you what I mean by this in a moment. When it comes to trying to get rid of or treat this painful problem. So again, I have people that reach out to me all the time, and they say, Dr. Charlie, I've heard there's this long versus short piriformis problem. How do I tell what the heck's going on? All of that stuff. Here's Mr. Six Packs, right? He said, well, first, you should determine if you have a long or short piriformis problem, and based on that, you should act. So this is a common question or point of confusion I know is out there because people are always reaching out to me. So I wanted to clear it up in this video. So basically, what Mr. Six Packs is saying is you should assess what kind of piriformis problem you have, and this will then tell you what to do about it or how to treat it. You are probably, if you're watching this video, you're probably wondering the same thing. So we're going to chat about it and clear it up. So look, this belief assumes three things. Number one, that the piriformis syndrome is actually the cause of your pain. If you're still confused about the cause of your pain, you want to get as close as possible and get as much clarity as possible around, again, what could be going on. And you want to avoid MRIs, things like that, and go ahead, click above, just download a free copy of my DIY diagnostic guide. Got all kinds of cool algorithms and things like that that will help get you closer to the truth. So it also assumes, number two, that you can actually tell if you have a long or short piriformis muscle. And then number three, that the type of piriformis syndrome you have determines how to best treat it. So first things first, just realize that I'm going to show you a quick DIY movement test that many say shows or proves sort of whether you have a long or short piriformis problem. Just realize, like FYI, heads up, because of the way the muscle is anatomically sort of aligned within the buttock, there are other ways to test this as well. So if you've watched other videos on this, Squat University video, based off the sort of action of the muscle when the hip is below 90 or 60 degrees, some people argue, versus above it, just the position of the hip can kind of change how you might assess it. So there are other ways. You can check that out if you want, but I'm going to show you a seated one here in a second that is super simple and straightforward. So here it is. And again, you're looking sort of at that angle, how far or how mobile or not mobile the leg or the hip basically is. So real quick, I want you to do this test now. I call it the seated figure 4 stretch test. And what I want you to do is take a seat in a chair and take your non-painful good leg, take your good leg, and place the ankle of that leg up on your opposite knee, like this. So let's just say, for example, my left butt cheek and leg is the one that hurts. So I would place my right leg in this position first. So test the good leg so we have comparison. Get a sense for how far the leg or the knee drops towards the floor. You can kind of see my angle, the overlay of the lines there. Get an idea of how it moves on the good side. Now go ahead and take the leg that hurts, the bad side, if you will, the painful side, and do the same thing. And compare the two sides. So you can see here, my good side is actually has less motion, it's sticking more up in the air, versus the painful bad side in this example. I don't have any pain. We'll talk more about that later, but you can see that there is a difference. So is there a difference between them for you, right versus left? Yes or no? And basically the concept is this. If the leg on the painful side drops closer to the floor than the non-painful side, like the one below. So painful side, I think that's on your right. You can see that it's kind of closer to parallel with the floor versus the good leg, the non-painful side is sticking up higher in the air, right? So if the leg on the painful side drops closer to the floor, like it does here, some would call this long piriformis syndrome. And like this guy says, hey, first you determine what it is, and then based on that, you determine what to do. So based on these findings, this, right, long piriformis problem, you would then conclude the piriformis on the painful side is actually overstretched. Again, this is just relative to your other side. That's it. And needs tightening or strengthening, needs shortening. So we're going to talk more about treatment later, but that's sort of the basic assumption. And look, this makes total logical sense. But what about if you discover the opposite? The painful side sticks way up in the air like this. And your good side moves gooder, moves better than the painful side. So this is identified or kind of points to some as a short piriformis syndrome because the painful side is actually less mobile or stiffer or tighter and therefore must need stretching, right? So essentially, the assessment determines the treatment. So if this, then do that type of logic, right? And maybe, but here's my beef with this whole short versus long piriformis syndrome assessment. So problem number one, the truth is that many things other than the piriformis muscle, nerves, joints, other muscles, ligaments, genetics, your brain in pain can affect how much your leg moves or doesn't move in this position or any position for that matter. So the test cannot isolate only the piriformis muscle and therefore cannot tell you if you have a long or short piriformis issue. So no matter what anybody tells you, a hip joint, no matter the position, whether you go and you watch Squat University or Bob and Brad, right, or whatever, or me, right, the whole point is that no matter the position of the leg, there are many structures involved when you're wiggling the leg around. And you can't just therefore pinpoint, say, this is a piriformis problem only in isolation, and therefore you can't really tell if it's long or short. So for example, an angry sciatic nerve will stop you in your tracks if you try the figure 4 stretch test. So it'll make things appear to be tight and short, but it just hurts, right? It's angry. An arthritic hip joint just won't go, feels very stiff and may restrict your ability to get in this position. It's not the piriformis, has nothing to do with it at all. It might just be that your hip joint is yucky and it doesn't like moving in that particular direction. So maybe there's something completely unrelated to the hip or the piriformis or whatever we're trying to assess, and it's an old knee injury that doesn't want you to twist your leg. A lot of meniscus problems or joint problems might not like this position, and this may prevent you from achieving your full range of motion. Or it could be as simple as this. This is kind of what I believe, right? You hurt, and your brain perceives this motion to be threatening and won't allow you to do it. It could be that simple. Even, if you looked at that test, you might have said to yourself, ooh, you didn't even have to do it yet. You might have said, ooh, that's going to be really yucky. And your alarm system already started to go off before you even went into the test. So it could be as simple as this. So look, all these possible variables that impact how your leg moves make the whole long versus short piriformis syndrome assessment completely invalid. So it doesn't measure what you're trying to measure. So what's the point of the test? What does it tell us or measure? Not a whole lot. It simply tells us how your leg moves, again, or doesn't move, left compared to right in this position, and if it hurts or not. Problem number two, the way you move or don't move could be completely normal for you and your body and may have nothing to do with the symptoms you feel. Perhaps you're a gymnast, a dancer, a hockey or a soccer player, and have more or less motion on one leg versus the other. Maybe you just have a habit of sitting with your legs crossed or sleeping in a certain position, and you've just developed or acquired more motion in one leg versus the other. There's well-documented cases of this. If you look at a baseball pitcher, their throwing arm is going to have way more motion one way than it will the other, and that's completely normal. It's not something that needs fixing. So chances are any difference left to right in the amount of motion you have is completely normal, and people who have no pain often have a side-to-side difference in motion. So therefore, just because the painful side moves more or less than the non-painful side does not mean it's abnormal or the reason for your pain or that it needs any treatment at all. So take me, for example. Look, I have no buttock, hip, or leg pain, yet my right side is clearly stiffer than my left. I wasn't mocking this up for the presentation. If you look at my right leg, sorry for the sun, it sticks way up. You can see the height there, right? If you look at my left leg, it goes down to the floor. But I feel no pain. It's completely normal for me. But look, if I develop pain tomorrow, how interesting is this, right? I'd be going somewhere looking for a cause, looking for the issue, right? I'd be looking on YouTube. Would short piriformis syndrome suddenly become the cause? And stretching the treatment? Just something, to think about and kind of ponder on. Because again, I don't have any problem now. So it clearly isn't an issue. But then if I develop pain, right, all of a sudden it becomes a problem. So one more example, take your right hand and reach up behind your back as far as you can. Now take your left hand and do the same. Do you notice any difference, right? So I know I'm small down in the corner here, but you just reaching up behind. That's my right arm, right? Hopefully you can see that. And this is my left arm. So you can see that my left arm goes clearly further than my right arm. Again, hopefully you can see that, but try it for yourself. So yeah, there's a difference. And most people have a difference because usually their dominant side is a little bit bulkier, a little bit stronger, a little bit more stiff, and has less range of motion. Not always, but usually. And this is completely normal. Of course, that is until you develop pain and then it needs fixing. It needs to be stretched out. Now, what happens if things look like this? So there wasn't a side-to-side difference, but you have pain. You're like, they both move the same and I don't hurt on that side, but it has the same motion. So what the heck's going on, right? This is a picture of my wife. She has really, symmetrical motion and good motion in her hips. Oh, right. What do we do about this? Now we're like totally confused. We're like, maybe, well, do we need stretching or do we need strengthening or what do I do? So sorry, but we can't help you. Right? If we're going off of that test, I'm kidding, okay? But if we're going off of that test and we're like, oh no, we've reached sort of like a stalemate, there's a standstill, there's same motion. Oh my gosh, we're so confused because it doesn't show long or short. It's just kind of like, oh, we don't know what to do. So yeah, I'm kidding, right? But really, there is no ability to accurately assess whether the piriformis muscle is long or short. Therefore, long or short piriformis syndrome only exists based upon assumptions and in theory. And you know what they say about making assumptions, right? So the long versus short piriformis syndrome concept is completely made up. Yeah, there you go. I said it. The argument is dead, okay? People like this idea of like, oh, well, I got to figure out what's going on. And if I know, right, that it's long versus short, then I should do this. So they like this algorithmic approach, but it's not that straightforward, folks. It's actually simpler than that. I'll explain that here in a minute. But that adds sort of like a shiny object, right? You go down, you hunt for information about what could be going on. You spend a lot of time looking to determine, is it this or is it that? Then you end up confused and you don't know what to do. So then you try other things, right? It's just crazy. It's just chaotic. So just rid your brain of this whole long versus short piriformis syndrome debate. The argument no longer stands. So let's go back to the statement. Well, first you should determine if you have a long versus short piriformis problem, right? And then we have this question of, cool, now we kind of know what it is. And based on that, we should act, right? Well, hopefully by now, look, we've cleared up that we cannot, we talked about why we cannot determine if you have a long or short piriformis problem. And therefore, there is no special treatment unique to long versus short type of piriformis syndrome because it doesn't exist. It's completely fabricated, right, to lead you down a rabbit hole or to try to give you, let me digress, okay? Not to lead you down a rabbit hole. I don't think that's the intent, all right? But it's put out there to try to give you, the person in pain, something to grab onto, something to sink your teeth into, to say like, now I know what it is, to try to, put into terms that you can understand. But again, it's not that straightforward. And there is no diagnosis of you have a long or short piriformis syndrome problem, okay? It's almost impossible to tell, number one, if you have piriformis syndrome to begin with. And number two, now we're gonna go even further. We're gonna say that we have some way to determine if it's long versus short. Heck no, doesn't work like that. All right, so basically, look, how do we know how we should treat it or how we should act in his terms, right? Or what we should do to treat I'm gonna call it your pain in the butt. Here's how. So this is gonna be really freeing to a lot of people, or it's gonna frustrate the heck out of you. All right, so by scientifically testing what works versus what doesn't. not by guessing, not by living in theory land, not because it's what everyone else is doing, or by doing things that confirm our own bias. This is the big one. Okay, I'm all for thinking outside the box and considering new ways to approach things, like absolutely. But realize that these ideas only exist in theory and not in data. So many doctors, therapists, other people who try to help people like you who might be dealing with a pain in the bottom, they do it because that's what they were taught, or that's what they were led to believe. That's a school of thought they were sort of fed, and they don't challenge it, period. That's it. And then they go on trying to prove that thing, because that's all they have in their brain, they can't see outside of it, works and is the way to solve the problem. So again, this is like everybody you go to see is wearing their own goggles, and they see things that they want to see, right? And they try to fit you into that box, that treatment. If it doesn't work, you're out of luck. So look, this may or may not be what works best for you. You've got to have somebody who can step outside and kind of see things as they are. The only person, really interesting here, the only person who can determine what works for you is you. So like, you have a power. I'm telling you, it's a power. You have a power that nobody else has in the healthcare sort of space world. Anybody who's trying to help you solve this problem. You are actually in the vehicle. You can plug into the feelings, the sensations, right? You can, you're with yourself 24 hours a day. You can tell what makes it better, what makes it worse, things like that, right? Like, you are inside of your own body, and which is causing you problems at the moment if you're watching this. And therefore, you have a power that nobody else can, to actually plug into the thing, right? Live, real time, 24/7, that is causing you problems. And look, that's great, but if you just do a bunch of random things, you're going to get a random result. So you need to follow a system to solve this. Otherwise, you're just guessing and hoping things will work out. So there's this idea that you can't manage what you don't measure. There's some quote here, I don't know who said it, but it's awesome and it's true, right? So for example, if you're trying to correct your diabetes, which is a blood sugar problem, or your hypertension, high blood pressure problem, or you're trying to see if what you're doing is helping making your infection worse or less or whatever, right? You're looking at white blood cell count. Same thing with weight. It's super simple. You get on the scale, right? So there'll be no clear way to manage these conditions or these problems, right, without a solid, objective, and clear baseline of data to reflect upon and determine the effect of treatment. So we're looking at the effect of treatment, right? We have to have, okay, I stepped on the scale this day and I was 150 pounds. How do you know if your diet's working to help you if your objective is to lose weight? Well, you manipulate your diet, maybe one variable at a time, or you get rid of meat, or you only eat this, or you don't eat at all, right? You fast, whatever, okay? Well, what happens is you do that for a reasonable amount of time, and then you come back and you remeasure, and you compare it to your baseline. Are you heavier, right? Worse, if you're trying to lose weight. Are you same? No change, right? Or are things better? You've lost the weight, you've achieved the objective that you were trying to achieve, right? So you need a baseline. But we don't do that when it comes to solving these problems, right? So same thing goes with solving a problem as it relates to, if it's piriformis, a muscle problem, a joint problem, a back problem, causing pain in the buttock, whatever it is. You've got to create some type of baseline. Otherwise, you're just running around like a squirrel, all right? So same thing goes with these problems. You need to have a baseline measurement of what's going on so you can determine if what you're doing is helping or not helping, or a waste of your time. Right? Otherwise, you're just trying random things and running around like a chicken with your head cut off, doing a bunch of random stuff and wondering why you're not getting better, right? So it's this idea of squirrel. So you first need to measure how your body moves, and then we can systematically treat your body using motion, which is just an input to the system, and measure the output or the result, right? For same, better, or worse. So this guides us in determining what we should do or shouldn't do. So in simple terms, an input is just something you're doing to solve your problem, right? A stimulus you're providing, in this case, the body, right? To determine, to try to impact it. In this case, you're trying to reduce symptoms probably, right? An output is just the result of doing that thing, again, on your body for same, better, or worse. So there are all kinds of possible inputs: heating pads, lotions, creams, energy work, meditation, dietary changes, pills, shots, surgery, motion, exercise. Whatever you want to call it, these are just inputs, again, little things to probe the system to see what happens. So the answer to this question of, Dr. Charlie, should I stretch it, strengthen it? Should I do both? Should I do neither? Just completely avoid it and leave it alone? Is really one of those, well, look, it just depends. And I don't say that to kind of be like everyone else and to be elusive about the answer. But the truth is that the answer lies in collecting the data in the scientific method and following a process. So now, I don't want to sound like a hypocrite, right? Maybe you've seen this other video of mine. I'll include it above, and I recommend you watch it. The one where I talk about not stretching, piriformis syndrome, stop stretching, that one, right? You'll notice I recommend shortening or strengthening on occasion for piriformis syndrome type problems. And look, as with any treatment, sometimes it works for people and sometimes it doesn't. There's not one size fits all. So get that this recommendation at the core really has nothing to do with whether you have a long or a short piriformis problem, because there is no such thing. So even if you have a piriformis syndrome as the cause of your pain at all. So instead, my logic is like super simple. Here it is. What you've been doing hasn't worked. It's what everyone's recommending you to do. Stretch, stretch, and when that doesn't work, just keep stretching. Do the figure 4 stretch, do the nerve glides. When that doesn't work, try more. Try some other form of stretching in disguise. Maybe you do yoga, maybe you do some type of foam rolling. It's all just lengthening the tissue. Real quick to help prove my point, right? Let me ask you a silly question. So what's the opposite of black? White. Bingo, you got it. That is it. That is my logic. That is how I solve problems. Let me make it clear. All right. So look, if stretching and lengthening, pulling point A and point B, that's how I define lengthening apart. So if lengthening the painful area equals not working, then what's the opposite of not working? Working. And what's the opposite of lengthening or pulling the two parts further apart? Pulling them together or shortening them or contracting them. Or this is what you might call strengthening. And this is it. So you apply this same concept, right? So this is how I solve problems. Basic logic. In this case, I call it using the rule of opposites. And again, you do this every single day and it makes total sense. But then when people hear in this regard, they're like kind of confused by it. Like, it can't be that simple. Charlie, you must know something that I don't. No, I know a process way better than you do. Okay. But you can absolutely learn it. So I follow logic in a framework versus just trying random things. Okay. So here it is. Look, when was the last time you took like a screw, right? Or maybe you had a ratchet set or something. You needed to tighten something. Maybe you hang a picture on the wall, right? What did you do? So let's just say you knew nothing about, how to do this. You've never used a screwdriver before, like, I don't know, you're a caveman or a cavewoman or something like that, or you're a young child and you just getting into construction stuff and you're helping your parents, whatever, all right? So you go and you take this screw, it's Phillips head, you put it in, right? And you start to turn it. And you're going this way. For anybody who can't see, it's counterclockwise, it's lefty, okay, lefty-loosey. And the screw just isn't going in. Wow, that's crazy, right? It's just not designed to do that. But it's not going in, and then what does your brain say? Well, mom or dad, or if you're a caveman, hoo-ha-ha, or whatever, right? The idea is that it's not working. So what do I do? Well, if you're going to the left and it's not working, then what's the opposite of not working? Working. So what's the opposite of the way you're going right now that isn't working? Well, I'm going to the left. Go to the right. Great. Lefty-loosey. Surprise. Righty-tighty. All right. So rule of opposites. Pretty powerful stuff. So look, I have no clue when I recommend to lengthen or shorten or stretch or strengthen or do this motion or that motion. Number one, if your piriformis is tight or not, based off the assessment. We talked about how the assessment isn't valid. It doesn't actually measure what you're trying to measure. It doesn't work because you're assessing so many things. And number two, even if it did, right, I don't even know, or even if it was tight, I don't even know if it matters. It could just be normal for you. Or if it's loose, maybe it's normal for you because of what you did growing up. Number three, if things are in fact tight, maybe your legs like mine sticking up in the air, right? What's restricting it? Is it the hip joint, the buttock muscles? You're just in pain and it hurts to move. It's really difficult to know, especially as it relates to piriformis problem, because there's a lot going on there. So you can't just isolate that. There are clear signs when you put together a picture of things, but just realize that, I don't care. I don't need to know these things. And neither do you. So just let go of the fact that you need to know more in order to solve your problem. Because at the end of the day, all we're doing is just testing the body, establishing the baseline, getting on the scale, recording that, treating the body, doing something, right? And then retesting the body using a systematic process and many experiments to collect data and lead us towards the solution, closer to the truth, whatever that is. If your objective is to have more pain, then yeah, we can absolutely do that, right? If your objective is to have less pain, then that is the goal. We're trying to see, do things move us closer to that? So look, it may not be easy. It's definitely not sexy or exciting, but it is that simple. You've got to just trust the process. So look, I leave you with this. If you're overwhelmed and you're overloaded by all the information and ways to treat this complex problem, like first thing you do is just not watch any more videos, okay? And just focus on doing less. So there's this problem solving strategy or sort of concept, fundamental idea called Occam's razor. It's this idea, look, the simplest solution is almost always the best solution. Doing more when people are in pain, they're desperate. They want to do more and more and more because they feel like they're doing something actively to try to solve the problem. And therefore it will get them there quicker. They'll have a better chance. The more stuff they throw at the wall, they'll have a better chance of solving it. But in fact, all it does is it muddies the water. It causes confusion and it actually restricts their ability to heal because they don't have clean data, right? So more does not equal better. Less is more. Stay focused. And that's it. That's all I've got. So if you found this interesting, if you found this helpful, if you found it a little controversial, I like to stir the pot in a good way and make you think outside the box, then go ahead, let me know in the comments below. Again, be sure to hit subscribe as well as the bell for notifications if you found this, again, useful, interesting, outside the box. And yeah, let me know what else you'd like to learn or what other questions you have below. So until next time, everyone, thanks so much for watching and we will chat soon.